Hello, friends. Let's discussion today on Guardian Home Care Family about elder person health, recognizing and managing pain. Do you know how to recognize pain in an elderly person? Many caregivers and family members often overlook the subtle signs. Pain is not always expressed by words, especially in seniors who may struggle with speech after a stroke or who have conditions like aphasia. Recognizing pain is one of the most important skills in home care, because untreated pain can lead to unnecessary suffering, restlessness, and even a decline in health. In this video, we'll learn together how to recognize signs of pain, how to score it, what to observe, and how to carefully manage pain with medications and other approaches. We'll also look at the advantages and disadvantages of common pain treatments, and how you, as a guardian or caregiver, can make a real difference in the comfort and quality of life of your loved one. Understanding pain in the elderly. Pain in elder adults can be different from pain in younger people. Aging brings changes to the body. Joints stiffen, muscles weaken, nerves may become more sensitive, and chronic illnesses increase. Many elderly individuals live with arthritis, neuropathy, osteoporosis, or the after effects of surgery or injury. But here is the challenge. Older adults often underreport pain. Some may fear being a burden, others may think pain is a natural part of aging, and some simply cannot express it clearly due to speech or cognitive difficulties. For caregivers, this means paying close attention to the unspoken signs of pain. It's not only about asking, "Are you in pain?" but also about observing behavior, expressions, and reactions. Recognizing pain early allows timely treatment, prevents complications like sleeplessness or depression, and improves overall well-being. Recognizing signs of pain. 1. Facial expressions. One of the clearest indicators of pain is the face. Even when words are missing, the face speaks. Look for grimacing, tight lips, furrowed brows, clenched teeth, or sudden wincing. These small details often reveal discomfort. 2. Restlessness. Restlessness is another strong clue. An elderly person may keep shifting position, rubbing their arms or legs, or pacing if they can walk. But restlessness can also come from other causes, such as anxiety or the need to use the bathroom. As a caregiver, your job is to carefully distinguish the cause. Ask yourself, is this movement linked to pain, or is there another reason? Pain score system. To make pain measurable, caregivers often use a pain score chart. This can range from 0 to 10, where 0 means no pain and 10 means the worst imaginable pain. For patients who can speak clearly, ask, on a scale of 0 to 10, how much pain are you feeling right now? For patients who cannot speak clearly, use the visual faces scale. Show the chart with smiling face at 0 and crying face at 10. Let them point or observe which face they relate to. Special cases, stroke and aphasia patients. Recognizing pain is especially important for people with aphasia or after a stroke. These individuals may lose their ability to speak or express themselves clearly, but pain is still there. It just hides behind silent signals. For them, facial expressions and body language become your main guide. Notice tightening of the jaw, grimacing, tears in the eyes, or refusal to move a limb. Touch can also provide information. Gently press or hold the affected area and observe their reaction. If they pull away, wince, or become more restless, it's a sign of pain. As caregivers, patience and sensitivity are key. Never assume silence means comfort. Silence may mean they cannot communicate. What to do about pain? Once you suspect pain, what should you do? The first step is to ask gently. Sometimes an elderly person will only admit pain after several gentle questions. Try rephrasing. Do you feel any discomfort right now? Is your back or leg bothering you? Would you like me to adjust your position? Next, use gentle touch to check for painful spots. Carefully press along the shoulders, arms, or legs. If the person flinches, that area may hurt. Always record your observations. Write down when the pain occurred, what the signs were, and how severe it seemed. Use the pain score if possible. This record helps doctors or nurses adjust treatment and make sure pain isn't ignored. Pain medications explained. Tablets are one of the most common forms of pain medications. They usually begin to work within 30 minutes. The advantage of tablets is that they act relatively quickly and are easy to administer. However, some elderly patients may have difficulty swallowing tablets, and side effects like stomach upset must be watched closely. When to call a doctor. Always remember, not all pain can be managed at home. Call a doctor if pain is severe, sudden, or does not improve with prescribed medication. Also seek help if new symptoms appear, such as chest pain, shortness of breath, or sudden weakness. Never increase or change medication without medical advice. Guardian home care means being watchful and caring, but also knowing when to seek professional help. Please subscribe our YouTube channel to get more videos. See you soon with the next video. Bye.